Are you being offered an employer-based Medicare Advantage plan as retiree coverage? How does that compare to all the options out there? Let's dive in. So if you're being offered a Medicare Advantage plan from your employer as retiree coverage once you turn 65 or retire, there are a couple things you're going to want to take into consideration when comparing that versus a regular Medicare Advantage plan or original Medicare with a supplemental. Just like a Medicare Advantage plan that's offered to the public, an employer-based Medicare Advantage plan is also an equivalent to original Medicare, but offered by a private company instead. But there are some key differences in how this employer-based Medicare Advantage plan functions from a normal public Medicare Advantage plan or a Medicare Advantage plan that's offered to the general public. Now, the biggest differences we're going to see are in things like premiums, copays, networks, and benefits, pretty much the whole picture. Let's start at the very beginning, premiums. Depending on how long you've worked for an employer, there may actually be a premium associated with this Medicare Advantage plan, and in some cases, it could be a pretty hefty premium. Now keep in mind with any Medicare Advantage plan, you still need to continue to pay your premiums for Medicare Part B to the federal government. Any premium for the Medicare Advantage plan would be on top of that. Depending on how long you've worked for an employer, there may be no premium for this Medicare Advantage plan, or there may be a quite exorbitant premium for that Medicare Advantage plan. I've seen them range anywhere from $80 a month to almost $400 a month for a Medicare Advantage plan. Now, paying that price, whether that's a good thing to do or a bad thing to do, is going to be dependent on what the benefits are that they offer you, or what are the copays and the out-of-pockets that come with those plans. Now, in general, from what I've seen from the biggest corporations, telephone companies or pharmaceutical companies or school boards or states, some of the out-of-pocket costs are actually quite good in these Medicare Advantage plans, meaning from what I've seen experience-wise, the copays are minimal or nominal, and the out-of-pocket maxes are actually very, very low. In the majority of Medicare Advantage plans that I've seen offered by a major corporation or by a state, the out-of-pocket max might range from $400 a year to maybe $1,000 a year at most. That's really not much whatsoever. If the plan is free, well then that's not a bad option to have a free plan that has an out-of-pocket max of maybe $400 or $500. But if that Medicare Advantage plan comes with a substantial premium, there are some other things we want to consider, which is true of most Medicare Advantage plans, including employer-based Medicare Advantage plans, which are the following. Medicare Advantage plans are going to have a network. You are going to have to find yourself within a network of doctors, and if you don't like that or you don't want that restriction on freedom, maybe it's not worth whatever the plan is asking you to pay when there are alternative options that we'll get into, like using a Medicare supplement with original Medicare instead. So one of the biggest things to consider is that in an employer-based Medicare Advantage plan, there will still be a network, and in some states, recently like New York, some nurses unions, some state workers that were given the option to join into a Medicare Advantage plan after the state transitioned into doing so, didn't like the idea of that because people that work in the healthcare field can easily see the network restrictions can actually create a big problem. In addition to network restrictions creating a big problem, there's also prior authorizations that come with a Medicare Advantage plan. Unlike original Medicare that's pretty liberal with what's covered, a Medicare Advantage plan's goal is to control costs and to do that by requiring prior authorizations on bigger services. So when joining into an employer-based Medicare Advantage plan, keep in mind that there will be a network and there will still be things like prior authorization. Now, again, the cost of this plan will be a huge determinant on whether this is a good idea or not. Every single person's situation is different, and I don't advise taking a generic YouTube video advice. I advise reaching out to a broker to discuss this depending on your scenario. But one thing to keep in mind when thinking about employer-based Medicare Advantage plans is this. The goal of a Medicare Advantage plan is to help curb costs. And for an employer that pays a large sum of money to keep their retirees covered after they stop working, well, there's a huge benefit to them to put you into this Medicare Advantage plan, because Medicare Advantage plans are funded by the federal government. So when you join into an Advantage plan, the government gives them a huge chunk of money to subsidize you. So out of a hypothetical example, if an employer was paying $20,000 a year to keep you employed once you retire, well, if you join into a Medicare Advantage plan, the government fronts maybe half of that, if not more, meaning $10,000 or $15,000 worth of the cost of the employer now comes from the government, and they're only putting out a small fraction of what they used to have to put out. That's why states like New Jersey and New York and many other states out there have taken their state employees off of a typical retiree plan that they pay for in full and shifted them over to a Medicare Advantage plan in which the government subsidizes part of that cost. In essence, it's a way to save the employer money, okay? Now, as we talk about this Medicare Advantage plan offered by the employer, again, so many factors come into play. Premium, out-of-pocket costs, networks, prior authorizations, but the bottom line is this. When you are thinking about what should I do with this retiree-based Medicare Advantage plan for my employer, should I take it or should I not? Well, you've got to look at the bottom line. What's the cost? And is it more or less cost beneficial to choose a regular Medicare Advantage plan or stick with original Medicare and choose a Medicare supplemental? For example, I've seen people who are offered a Medicare Advantage plan as an employer-based plan that was $350 a month in addition to the money they paid to have Medicare. Whereas comparatively, a supplemental would have been $150 a month and actually been more comprehensive and given them that complete freedom. So in the scenario in which your employer-based Medicare Advantage plan is pretty expensive, sticking with original Medicare and a supplemental might actually be the best cost. But if your employer-based Medicare Advantage plan is free, well, if the out-of-pocket isn't bad, it may be a good place to stay knowing this final piece. Employer-based Medicare Advantage plans have the right to change their benefits on you at any time. And unfortunately, unlike normal Medicare Advantage plans, employer-based Medicare Advantage plans aren't stuck to the same stringent regulations. They don't have to easily make your benefits public. They don't have to easily make the network accessible or easy to view which doctors are in or outside of it. Recent people that have these types of plans have complained that they're given an option of maybe 30 or 60 days to choose whether they want the plan or not, and they can't even get their hands on a network so they can see which doctors are involved or not. So it's definitely important to realize that when making this decision, there are many factors that come into play. I wouldn't, as I've already mentioned, advise watching a bunch of videos or doing your own research on this. I would highly recommend speaking with a specialist, whether it's ourselves or somebody else, to determine based on your situation what's going to be best, and also keeping in mind this. When you join an employer-based Medicare Advantage plan, it works just like a normal Medicare Advantage plan in that if you don't like the plan in the future and you want to go back to original Medicare and a supplemental, you are going to have to answer health questions unless the employer has completely taken that plan away and eliminated it. If they change it and you don't like it, you're either stuck there or you can go back to original Medicare and have to answer health questions to go back to the supplemental. So depending on your situation, feel free to reach out to us. We're happy to go over this with you and give you a fair, unbiased education on what your scenario looks like versus the other options in your area. So feel free to reach out to us at our website at www.njlifeandhealth.com. Give us a phone call at our office, 848-226-6897, or leave a comment below. We'll be happy to respond and help you understand what's going on based on your scenario.